Hey everyone, my name is Maddie,
And I'm Kenzie.
and we're going to be discussing trench fever.
Trench fever is caused by the bacteria Bartonella quintana. This was shown by Strong et al. In 1918. They found the presence of Bartonella quintana within the plasma of patients with trench fever. The pathogen was also detected in the urine of those suffering from trench fever.
Bartonella quintana is an opportunistic pathogen that is transmitted through the bite of the body louse, which is also known as lice, which is also the cause of trench fever. Bartonella is also a facultative pathogen, meaning that it can survive without relying solely on its host, and it also does not have to be inside its host to reproduce. The vector for Bartonella quintana is lice, and its natural reservoir consists primarily of mammals, specifically humans. Once Bartonella quintana enters the body, it is able to survive to the point of infection in two primary ways. A type 4 secretion system with Bartonella quintana has been shown to affect erythrocyte adhesion within its host. This is important for initial entry of Bartonella quintana into the bloodstream. Bartonella quintana is able to survive normally toxic hemin concentrations with the help of a few hemin-related proteins that are found within the host.
The symptoms of trench fever can consist of fever, bone pain, and skin lesions. Skin lesions are most common in those who already have a weakened immune system. You are really only at risk of death or lifelong disability from trench fever if you have endocarditis, which is inflammation of the heart valves. It is important to note that individuals who are experiencing homelessness and do not have access to showers and/or laundry services are most at risk now for contracting trench fever. The first major outbreak of trench fever occurred during the First World War, affecting both German and Allied armies. This epidemic was estimated to have affected over 1 million people, including military and non-military personnel. Cases of trench fever were noted prior to World War I. However, this outbreak caused the importance and severity of this disease to be recognized. After World War I, the incidence decreased and so did medical and public attention on this disease. However, another outbreak during World War II caused this disease to enter the limelight again. The agent that causes trench fever is a cellular pathogen. Bartonella quintana is a bacterium in the genus Bacillus. It is a gram-negative rod.
In order to prevent Bartonella quintana, you want to avoid exposure to human body lice. This can be done by not sharing clothing, bedding, or towels with people who might have lice. It is also important to keep up good hygiene, so this means showering and doing laundry regularly, especially if you are living or are in close contact with someone living in a congregate shelter or lack access to housing. Also, it is important to note that when washing clothes and bedding that may be infested with lice, to use hot water above 55 degrees Celsius, which is 130 degrees Fahrenheit, and dry your laundry on high heat to kill the lice and their eggs. The primary means for diagnosing trench fever are serology tests and molecular detection, including PCR testing of blood serum. Serology tests are diagnostic examinations of blood serum. Serology tests cannot always differentiate between different Bartonella species and can cause a false positive even after treatment. Molecular detection can be useful with culture-negative endocarditis. Molecular detection should only be performed on excised heart valve tissue if the patient with endocarditis requires a surgical valvular replacement. The main treatment for trench fever is antibiotics such as tetracycline, aminoglycosides, and macrolides. It is often that more than one antibiotic is used to treat trench fever. Here's a list of the references that were used for this presentation. Thank you all for listening, and I hope you all learned a little bit more about trench fever. Please like, comment, and subscribe.